Hi, folks. John Adamson, the Rehab and Documentation Guru. There is an organization called the Medicare Rights Center, and they publish a periodical, I don't know how often it comes out, called Medicare Watch. And in it, they cite that a number of states are struggling right now to meet Medicaid demand. And why is that? Well, they pin it to COVID-19. But let me ask you something. Did the disease cause the lack of Medicaid funds from coming in? But here's another thing. Where do the funds come from? They come from tax revenues. The reason that Medicaid is starting to see a struggle is because tax revenues are hugely down. For instance, I have a small business which has been hurt during this time, and it's part of how I pay myself when I speak. When I do conferences, my Adamson Enterprises Inc. gets paid, and then Adamson Enterprises Inc. pays me. This is my S Corp. My revenues have been tremendously down. Do you know what my revenues partly help support? State revenues. The state of Virginia gets a portion of my revenues generated by Adamson Enterprises, which in part they use towards Medicaid benefits. We know, as of right now, there are over 30 million jobless claims in the United States. Many of those are private business owners. Like me, some of them generate far more income than I do. There are people without jobs who pay state taxes, and 50% of Medicaid's funding comes from tax revenue. States don't have the ability to just print more money like the federal government. And of course, when you print more money, the valuation of that money goes down over time. We have what's called inflation. So money, even though you might have the same amount of money, it becomes less valuable. So services start to charge more money. And some of those services bill entities like Medicaid. And it's the only way they can keep up because of inflation that will happen over time. So Medicaid is hurting right now. Think about that. Think about the fact that your patients that depend on Medicaid, many of whom do not have COVID, if the funding stops, they will be hurt. And if the money's not there, you don't have money to send. Think about those that also receive Medicaid that are the most vulnerable. I worked for a long time in the nursing home industry. Most patients in the nursing homes I worked in, by far most, were on Medicaid. And that Medicaid funding coming in did what? It paid for the care and the lodging and the food for that patient. What happens when facilities aren't getting as much money in because the funding through tax revenue dries up? Those patients are going to get less care. What's that going to cause? We already know that the care is subpar in most nursing homes. We know that. So what's going to be caused by reduced funding? Staff cuts. You're still going to have the same number of patients, but there's going to be less staff to take care of those patients. What else is going to happen? Salary cuts. And you know what? Even though the jobless rate is humongous right now, when the economy does open up, and it will eventually, there are going to be people that are going to look at CNA jobs and think, I'm not doing that. I can make a lot more money doing something else in this opening up economy. And the care provision is going to go down. And what's that going to do to all factor morbidity and mortality? Think about the things that care for a patient provides. It prevents APUs, acquired pressure ulcers. It makes sure people get fed, maintain their weight. It makes sure that they get their medicines on time when they need it. It makes sure that they have social programs that help them prevent them from going insane. The idea that we just need to come together to keep everything going while there's no funding works for a short time, but it will not work in the long run. And we need to open up the economy in order to generate tax revenue, which will drive healthcare funding to make sure that the least of these, and I say least not in least value, but those who are struggling the most and have the most issues that need caring for, can actually be cared for, because we'll have the money to hire the people, to provide the food, to give them the lodging that they need. It's time to open the economy. Anyway, I hope you're having a great day. It's Friday. We're about to have a holiday weekend. It's rainy here, and hopefully the sun will be coming out. Take care of yourself, and God bless.